Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Over the last 24 hours, we identified 678 new cases of COVID-19 in the province. Our labs completed about 14,000 tests, and the positivity rate was about 4.8%. There are currently active alerts in 178 schools and outbreaks in 4 schools. There are 282 total cases linked to these schools. In-school transmission has occurred in 23 schools, with 20 of these having only one new case occur as a result. Interestingly, when we look at daily new cases in school-aged populations, this week we are seeing an average of 80 new cases a day, significantly lower than the average of 140 new cases a day in this same population the week before school started. Supporting students so they can be in class provides a great benefit to our society and to our children, and it underscores the need to keep reducing community transmission to protect our schools. We still have work to do on that front. Our hospitalizations have declined this week, but remain high, with 726 people in hospital, including 119 admitted to the ICU. Unfortunately, 16 new deaths have also been reported to us in the last 24 hours. I extend my sympathies to all who are experiencing loss at this time, whether from COVID-19 or any other cause. Every death leaves a hole in the lives of those who love them, and current restrictions make it harder to support each other the way we are used to. I encourage all of us to reach out to anyone we know who is experiencing grief, to support them and let them know they are not alone. As you can see from our numbers this week, our positivity rate, active cases, and hospitalizations are continuing to decline. This is good news. I know the current restrictions are very difficult for many Albertans, including business owners. As I said yesterday, we are on a positive trend. Our numbers indicate that the restrictions we put in place last month, while extremely challenging, are helping to prevent more people from being exposed and getting sick with this virus. The overwhelming majority of Albertans are doing their part, not only by following the restrictions, but by embracing the spirit of them. We are protecting one another by reducing in-person interactions, which in turn is reducing the number of people who get sick, test positive, and ultimately require hospital care. And with more than 96,500 doses of vaccine administered, thousands of the most vulnerable seniors and healthcare workers now have an extra layer of protection. In a year that has already been extremely difficult, I am proud of the sacrifices and community spirit that Albertans have shown to produce these encouraging numbers. At the same time, we are not in the clear just yet. That is why no additional measures are being eased at this time. There are no changes being announced today. Our cases are falling, but we still have the second highest active case rate per capita in Canada. It is also particularly important to keep our current hospitalization numbers in context. While our hospitalizations have decreased significantly from the peak, they remain high. To put this in perspective, despite the progress we've made, there are just as many COVID patients in hospital today as there were on December 8th, the day that our current restrictions were first announced. This means that our health system continues to experience significant strains, and we must ease this burden as quickly as possible. We need to continue driving community transmission down. That is why it is essential that we keep the current measures in place for a little while longer, and why we all need to make good choices and to rigorously follow all the orders in place. We must keep limiting our in-person interactions as much as possible in every facet of our lives. As we go into the weekend, when more people tend to be out, I encourage everyone to be intentional and thoughtful with their outings and outdoor gatherings, especially as temperatures drop and it may be difficult to stay outdoors for long periods of time. The choices we all make tomorrow, this weekend, and over the coming weeks will help determine how the coming months look in our province. Together, we can keep protecting each other and the healthcare system we all rely on. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from Jeff Slack of 660 News. Your line is open.
Hi, Dr. Hinshaw. Thanks for taking my question. I understand we're not easing the restrictions today, but how long are you planning for this next extension? Are we looking at another 2 weeks, or is it more similar to close to a month?
Those decisions haven't yet been made, and essentially what we're doing is we're watching our hospitalizations, watching our ICU numbers particularly. Of course, it's encouraging to see the leading indicators of our case counts and our positivity rate going down. But ultimately, what is most important is that we make sure that our acute care system is able to respond to all of our health needs. And to do that, we need to give it a bit more time. And the exact amount of time, again, it will really depend on how we all collectively work together to keep those numbers coming down.
Operator, could you put through the next caller, please?
James Keller, Globe and Mail.
Hi, Dr. Hinshaw. I've got a question about vaccination for seniors. Why are seniors who live in congregate settings that are privately funded not prioritized as a group? My understanding is they'll be included in the phase focusing on seniors over 75, but they're still in a vulnerable setting that we think is especially risky. So can you confirm that that is where those people would fit in the vaccine rollout, and why are they not prioritized earlier if they essentially share the same risk factors as those in provincially funded settings?
When we looked at our data with respect to setting our early priorities, what we saw is that residents of long-term care and designated supportive living, some of which are privately funded and some of which are publicly funded, so all of those, or I should say privately and publicly operated, all of those residents in long-term care and designated supportive living facilities have been offered the vaccine. And it's those residents in those particular types of facilities who account for 2/3 of all of the deaths that we've seen in this province. We have not seen that same heavy death toll. We recognize that other seniors are at risk in other settings, and absolutely, again, we are working as soon as the vaccine comes into the province to be able to make that available to seniors 75 years of age and over, no matter where they live. But we did prioritize the settings where we have seen that heavy, heavy death toll as those who are most vulnerable to be able to receive the vaccine as early as possible in this first phase.
Operator, could you put through the next question, please?
Jesse Weisner, Global TV Calgary.
Hi, Dr. Hinshaw. So with the current restrictions not being lifted, what specific benchmark, be it R value, daily case counts, or a certain number of people in hospital and ICU, do we need to see those being lifted? And how often are those restrictions being reassessed? And have you made any further recommendations?
We are having those discussions with respect to the impacts and looking both at the impacts of historic levels of hospitalizations on the ability of our healthcare system to offer other services. Any number we set is always a risk trade-off, so there's no one perfect number that will tell us exactly the right time to shift. So what we're looking at is a combination of our new cases, of our positivity rate, our R value, and our hospitalization and ICU numbers, to make sure that we're not just using one single metric, but all of those together. And the team that I work with, we look at those numbers on a daily basis, and we do have regular discussions with elected officials about the meaning of those numbers and about that planning and what our recommendations are about what we might be able to move forward to.
Operator, could you put through the next caller, please?
Chris Epp, CTV Calgary.
Thank you. Dr. Hinshaw, we now have a lab in Calgary offering for a fee rapid results within 4 hours. And I'm just wondering if you see, with services like that expanding, could you see restrictions being lifted for some events? For example, can you have a wedding with 50 people, 80 people, if they all have a negative test within the last 24 hours? And as part of that, too, how anxious are you to see these in-home tests that have been talked about and being used in the States, do you think that could make a big difference here in Canada as we wait for the vaccination rollout to finish?
Having access to more testing could help with our ability to control the spread of the virus. What's really important, though, is that we remember that any test is just a point in time, and not all tests are created equal. So depending on what options different labs might be providing for private pay testing, it's really important if someone's going to purchase a test that they do their homework and they find out if that lab is using a test that's approved by Health Canada for the purposes of diagnosing COVID-19. It's also really important to understand that even the gold standard PCR tests that our lab uses, and any test, in fact, is just a snapshot in time. So when you reference, for example, having a wedding with 80 people where everyone has a negative result within the 24 or 48 hours before the event, one of the challenges with that, and we've seen this in other settings, when you use a test to replace public health measures, then essentially you actually can sometimes have a worse situation, because if someone is incubating the virus, if they've been exposed and they don't know it, they may test positive on one day, and a day or two later they may test negative, on one day, and then a day or two later actually might be infectious without knowing it. So if people use a single point in time snapshot of a negative test as a free pass to do risky activities over the following week, that would actually make the situation worse. So we do need to make sure that when we're looking at these home testing options, rapid testing options, that they're used within a context where they can provide additional information and perhaps help us in the future maybe allow a certain number of additional activities, but there will always need to be some public health precautions because, again, testing does not replace those. It simply can help us to target them a little more effectively.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. You said that the province will do everything it can to get second doses to people within the allotted time frames. But if that cannot happen because of vaccine supply issues, what will the next step be?
We know with other vaccines that when someone has their first dose, there is no end date at which time they're no longer eligible for a second dose. And we know sometimes with some other vaccines that if there is a little bit of a longer interval between first and second dose, that the overall long-lasting immune response can sometimes be better with a little bit of a longer interval. There's still many unknowns with this specific Pfizer and Moderna vaccine, but when we look at some of those other pieces of evidence that come from other vaccines, what we would offer in terms of, first of all, again, as I've said before, wanting to do our utmost that every individual who's received their first dose does get their second dose within the 42-day timeline. If not, they will continue to be eligible and will receive it as soon as possible after that. And we are, of course, with all of our partners in other provinces and territories, working with the federal government to be using our current allocations as wisely as possible, and again, making those adjustments in our planning to try to be able to deliver within that 42-day window.
Operator, could you put through the next question, please?
Matt Woodman, CTV Edmonton.
Hi, Dr. Hinshaw. I have two questions for you. The first one is, it's been, today marks 1 year since you first addressed Albertans about the coronavirus and COVID-19. What are your takeaways about the past year and what has been the biggest challenge? We're also hearing from the province that all seniors have been vaccinated, yet we're hearing from some in the private long-term care who are saying there are about 12,000 seniors who haven't been vaccinated. So is that true, and if so, why?
Thank you. The last year has, of course, been a memorable one, I'm sure, for all of us. I know it's been an incredibly difficult year for many Albertans, and I think for all of us, there have been a lot of things that we've learned about the virus, about how to control it. We've learned about how we can support each other to be more resilient together. And, I think ultimately, what we've seen when we look at the trajectory of COVID-19 in this province We've seen our first wave in the spring brought down very quickly by the actions of Albertans coming together and bringing that curve down. We've seen an ability, again, of our collective action to keep those numbers low throughout the summer and early fall. And we saw that when the numbers started to get a little too high in November and December, when we started to see our healthcare system come under significant threat, that we were able, again, together to bring those numbers down. And I think it's important to remember, even though we continue to be in a difficult time, and I recognize the challenges not only of COVID-19 pressures, but the challenges of the restrictions, that our best path forward is working together to maintain those low numbers so that we can get back to some of those activities that we all enjoy. With respect to the private long-term care and designated supportive living, I want to be clear that long-term care and designated supportive living facilities in the province, some of them are operated by private operators, some are operated in the public system, but those particular beds that are designated and specified as long-term care and designated supportive living, those are, again, those facilities that were prioritized to receive the vaccine at the very beginning of phase 1. There are some facilities that provide seniors care, congregate care, that are not long-term care or designated supportive living site. And individuals who live in those facilities will be eligible as soon as the vaccine rolls out to seniors 75 and over. And as I mentioned earlier, the reason for the distinction was when we looked at long-term care and designated supportive living as a group, again, that's some private, some public operators, it is that group that is at the highest risk of severe outcomes like death. And so it is that group that was focused on in our early rollout, and it's that group that has at this point in time all been offered vaccines. We recognize, again, in some facilities there is a mix of beds that are either long-term care and DSL, where those individuals may be interacting on a daily basis with other seniors. And in some facilities, the whole group was offered vaccine at the same time. In others, in those mixed facilities, there has had to be a staggered approach because of the vaccine shortage. But in those mixed facilities, that also will be part of the rollout as soon as vaccine becomes available.
Operator, could you put through the next question, please?
Our next question comes from Jeff Labine of Edmonton Journal. Your line is open.
Jeff, I think you're on mute. Do you want to try that again?
There we go. I was just curious, why are we not easing restrictions on businesses by zone?
When we look at our numbers and we look at the hospitalizations and cases by zone, we do still see that we have fairly high numbers in some of the rural zones as well as the urban zones. I think there's a misconception that there are no cases and no impact in rural zones, but in actual fact, we have seen quite high numbers in some rural places. And when we look at the high amount of spread, again, well over 700 people in hospital in the province, and we have a provincial healthcare system, we need to make sure that we have our capacity within acute care freed up by bringing the community transmission down to bring down that pressure on the acute care system across the province. And at this point, the best way to do that is to make sure that provincially we continue to work together in this reduction of spread so that we can bring down that impact on our provincial healthcare system.
All right, we have time for 3 more questions. Operator, could you put through the next caller, please?
Jason Herring, Post Media.
Hi, Dr. Hinshaw. Alberta has not been publicly reporting the numbers of detected cases of new COVID variants each day. The province has also not publicly reported the breakdown of vaccines administered by first and second doses. This information is only provided upon media request. Why is the province not proactively and transparently providing this information to Albertans?
We provide a great deal of information, and if these 2 particular pieces of information would be something that would be of interest, then we can look into being able to provide those in a regular way. With respect to the first and second doses, I don't have that information available, but again, we can provide that offline, and we can look into the variant question as well.
Operator, could you put through the next caller, please?
Brian Miller of Yahoo News.
Hey, Dr. Hinshaw, thanks for taking the time today. This question is also related to the one-year anniversary. With the spotlight you received this past year and your role with areas such as restrictions, more people may be associating you with the political realm. Moving forward, how do you feel the role of the provincial health officer has changed, and how can physicians of the future be better prepared for that political spotlight while maintaining their independence as professionals devoted to public health?
The role of the Chief Medical Officer of Health has always been one of service to the public, and has always been one that has had a role in providing information. So whether it was my predecessor providing guidance and advice on the health impacts of the wildfires in Fort McMurray or the opioid crisis, or whether it was the previous predecessor who was working on the H1N1, this has always been a very public role. And I think it's important for anyone who is in public health to be able to provide advice to the public, to provide advice to decision makers in a way that is trustworthy and accurate. And that is certainly what I have always done my best to do, and know my colleagues do across this province. So I actually think that the role has stayed consistent over time, and I have taken great wisdom from the people who've been in this role before me and appreciate the path that they've set out.
Operator, could you put through the last question, please?
Chantel Wagner of Cat Medicine Hat News.
Hi there. You just addressed this question a few questions ago about reopening by zones. Why not take a regional approach when there has only been 35 cases or so in the Medicine Hat city and area, and when there's been a call to reopen businesses over the last few weeks?
I want to be clear that I understand that the restrictions have significant impacts on businesses, which have real impact on people's health with respect to employment, with respect to activities that support people's health. So none of these decisions are taken lightly. What is important, though, is that COVID-19 cannot be restricted to a specific municipality. And what we have seen certainly over the fall is how interconnected we all are, and the movement between different towns, movement between large urban centers and small rural areas, that all of that movement is part of what spreads COVID-19. We have seen in the entire South Zone our hospitalization levels starting to go up a little bit in recent days. And again, want to emphasize that our health system is provincial, that we do rely on that capacity not in any one specific area, but across the province. And we do need to monitor that and make sure that we have enough capacity before we start opening up. Because the worst thing would be that all of the sacrifices that have been made over the past several weeks, we would be squandering those by opening so quickly that our transmission rates would rebound when we have a baseline of over 700 people in hospital. And that's exactly what we need to avoid.
Thank you all for joining us today. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe evening.